Hey, Alex, what are you doing?
At this home, the screen time for kids would be limited, typically. But this is not a typical time, and Danielle's child
That's my Bubba.
is not home.
Is that your Debbie?
The screen is the family's only means to see each other right now.
I see you got a big comfy jacket on, don't you, buddy?
Danielle is on a virtual visit with son Alex. It's been this way for the last year.
I want to take my baby and hug him and, it's...
Although 18 years old, the state of Georgia considers Alex a dependent child with high needs. He has severe autism. Being away from family complicates his behavior even more, his mom says.
What is it like interacting with him?
Yeah, it's hard. It's very hard. There's visits a lot that you can tell he's biting his nails and I'm like, what's wrong? And he tries to get close to the screen and trying to come at mom.
Mwah.
Back in 2011, when Danielle served prison time for felony forgery, she gave guardianship of her special needs son to the grandmother. The grandmother died a year ago. That's when the state intervened. The agency tasked with child welfare, the Georgia Division of Family and Children Services, or DFACS, decided Alex needed to be placed in a residential facility for behavioral health. The problem? The closest available one was hundreds of miles away, near Houston, Texas.
They said there was no placements in Georgia.
Court records show DFACS alleged Danielle was not an appropriate placement for the child. These texts reveal a caseworker told Danielle, quote, "No local placement available. We've been looking for several months." The Texas site was his only option.
They want the family involved, and I'm like, well, I can go on there and see him, but I'm 4 states away, and it's not like I can just up and walk out.
I hope that my words do not fall on deaf ears.
Advocates have sounded the alarm on stories similar to Alex's. A joint committee in the state legislature is now tackling the issue of high needs cases. It's all connected to the cost of care. Advocates allege the state's own residential facilities can make more profit when they take more out-of-state patients, kids coming to Georgia for help, which in turn leaves fewer residential facility options for kids who are already state residents, meaning local kids have to leave Georgia for help. Child welfare workers also cite the lack of specialized training and staff shortages in our state. Finally, experts blame the state's own insurance company, Amerigroup, for failing to approve costly claims.
I personally reviewed and witnessed these extremely medically fragile children and youth being routinely and systematically denied medically necessary PRTF treatment. Regardless of the child or youth's medical circumstances, they will all receive the exact same formulaic denial notice.
The dilemma devastating for families like Danielle's, whose parental aunt is helping, seeking custody of Alex.
And I love you.
At the very least, getting resources for him here in Georgia.
They are supposed to provide services and help to prevent the placement, and they failed to do that.